Johns Hopkins Medicine proudly presents this brief 3-minute video tutorial on the supraclavicular brachial plexus block for the purpose of primary anesthesia in a patient with end-stage renal disease. With the ultrasound probe in the supraclavicular fossa, we try and identify pertinent anatomy. We believe we can see the superior, middle, and inferior trunks, along with the first rib and the pleura. We approach this block from a lateral to medial orientation, with the goal of keeping the target structures in plane and the needle in plane throughout the procedure. We first deposit local anesthetic between the first rib and the inferior trunk. In addition to coating the inferior aspect of the brachial plexus, it also pushes the brachial plexus more superficial, making the remaining block more easily accomplished. We attempt to deposit local anesthetic above and below each trunk. If the needle does not easily enter the space that we think is the separation between the trunks, we do not force it. Here we believe we have entered the space between the superior and middle trunk. Here we're repositioning the needle to be above the superior trunk and just below the prevertebral fascia. We're able to visualize the fascia dissecting off of the superior trunk. Using the Safe Local iOS mobile application, we calculate a safe dose of local anesthetic for our procedure and budget the remaining local anesthetic available for surgical supplementation. This is the budgeting function of the app for safe doses of local anesthetics for the surgeon. The calculations are based on Miller Anesthesia 8th edition with adjustments for comorbidities based on Rosenberg et al.'s work in their 2004 publication, Maximum Recommended Doses of Local Anesthetics, a multifactorial concept. Our case was a 78-kilogram male with end-stage renal disease. Based on this calculation, we were allowed 31 milliliters of local, and we used 25. With calculating the leftover for the surgeon, we came up with 9.86 milliliters. Dr. Lin and Dr. Ouanes created the Safe Local app based on the previously mentioned published data from Rosenberg and Miller. The app is available on the Apple App Store free of charge, with an expected future release in the Android operating system. We would like to thank our entire Division of Regional Anesthesia and Acute Pain Management at Johns Hopkins for their support.